Hi, Nanajwa. Hi, Felicia. Hello, Kofi. Books in effect. Hi, hi. Hello, everyone. Still waiting for more people to join. Doesn't look like there's anybody on. There's no one on Facebook yet. Let's see. Hi, Ellie. Hello. Welcome, everyone. Welcome. I didn't put the topic, but today we're going to be talking about hypertension in pregnancy. Kofi, please let me know whether the Facebook one is appearing. I know this is Instagram, but okay, yes. Hi, Mausi on Facebook, Ellie Mausi. Okay, so it looks like it's working on both social handles. Hello, everybody. Good to have you all. How's everybody's Saturday going? Just waiting for a few more people to join, and then we can start. It's going to be very interesting. We're going to be talking about hypertension in pregnancy. Facebook Live is on. Ellie Mausi, can you hear me from Facebook? You are the... Please give a thumbs up. Welcome, Auntie Gertrude. Hi. I'm still waiting for your people to join. Gertrude, where are your people? Okay, so before we start, I will talk a bit about myself. So I'm Dr. Karen Aminiampong. I'm currently in Cape Town, but I'm known to Jubil. Old Jubil clients will know me. So I'll be coming to a consulting room close by very, very soon. I'm currently specializing in obstetrics and gynecology. So women's health is my passion, and catching babies is also my passion. So today the topic we're going to talk about is hypertension in pregnancy, which is very, 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 very important because it's quite common. It's more common than we can think of. Hi, neck concepts. So Gertrude, the nurse manager, contacted me. Gertrude, you said they'll join. I'm still waiting for them. I don't see them. It's only my people who are on here. Okay, Nita Rana has also joined us. Okay, Ellie Mausi says that she can hear me on Facebook. Hello, mommy. My mommy is on. Hey, I have to be well behaved. Hello, mommy. Welcome to our session on hypertension in pregnancy. We're just waiting for a few more people to join. Gertrude, if you give me the go ahead, I'll start. Because I think. Okay, so I'm going to start. So we're talking about hypertension in pregnancy, which is much more common than we think. I'll be talking about the definition of hypertension, the types of hypertension we have, who is at risk of having hypertension, the symptoms and signs of hypertension, what effects the hypertension has on pregnancy and the baby. And we'll be discussing ways by which we can reduce our risk of getting hypertension in pregnancy. And then I'll take questions and then we can conclude. So really, what is hypertension? Hypertension is a clinical diagnosis, and it's made by having a blood pressure reading of 140/90. So if you take the blood pressure, we have the top one and the bottom one. So 140/90. But it shouldn't be on just one reading. It should be on two readings. So you take two readings apart. So a blood pressure more than 140/90 on two readings. So you do it now and you repeat it. And it should be ideally 4 hours apart. But most of the time we don't have the time to do it 4 hours apart because people have places to go or there just isn't much time. But usually when you have the first blood pressure reading and you repeat it, it's usually accurate. So you find out that it's really hypertension in pregnancy. So when we say hypertension in pregnancy, it's not, this topic today is not just covering hypertension, which only develops in pregnancy, but we're also talking about the type that is already in pre-existing. So there are two types of hypertension which can be seen in pregnancy. You can have a pregnant woman who already has hypertension. So that also is still hypertension in pregnancy. And then we have the hypertension that develops during pregnancy. So chronic hypertension is hypertension that already exists even before the woman is pregnant. So most of them usually know that they are hypertensive. And then also, some people don't realize they are hypertensive. It's only at the time they come in during the pregnancy that they get to find out that they are hypertensive. So any pregnant woman who is seen before 20 weeks, which is 5 months of pregnancy, who has blood pressure readings by the definition I've given, blood pressure of more than 140/90 on two separate occasions, is also considered to be having chronic hypertension. That is pre-existing hypertension, which was probably not picked up before she was pregnant. So it means that you can have hypertension, it will be there, but you don't know that you have it. From scientific research and observations, we know that in early pregnancy, the blood pressure decreases due to the physiological changes in going on with the pregnant woman. So the blood vessels open up or dilate. Then after 24 weeks, it begins to climb up again and increase. Then after delivery, it comes down again, and it might go up after 3 to 4 days and then stay the same. So if you are seen for the first time and you are less than 20 weeks and you are told that you have chronic hypertension, you shouldn't be. It will be a surprise because it's never been detected, but really it means that after the pregnancy, it's most likely that high blood pressure is not going to go away. So you have chronic hypertension. So that's for the chronic hypertension, which is pre-existing blood pressures in pregnancy. Then we have the ones that are associated with pregnancy. So we call those ones gestational hypertension. And it's important to know whether or not someone has hypertension in pregnancy, because the severity of the hypertension determines the degree of the effect on the baby and the mother. We also have some people not having any hypertension during the pregnancy, and then after delivery, sometimes even up to 6 weeks after delivery, you find out that there is high hypertension, especially common between the third and fourth day, or even up to a week. So that is the definition of hypertension, and then the types of hypertension we have. So the definition is blood pressure readings of more than 140/90 should be on 2 separate occasions. And then the types are the ones that are already pre-existing, and then the type that develops in pregnancy, usually after 20 weeks. So even with the type that develops in pregnancy, we like to know whether there is protein in the urine. So you realize that at each antenatal visit, you have your blood pressure, your weight, blood pressure, and your urine tested at every single visit. And it's not for nothing, it's for a reason. So with the checking of the blood pressure, we understand that already. So that is to determine whether or not at that particular time you have developed hypertension. Then we also check for the urine. Apart from looking for proteins, we're looking for other things, but today I'll talk about specifically the protein in the urine. So we look out for protein in the urine because that is also that also gives us an idea of whether or not hypertension is developing in pregnancy. Even with the types of hypertension in pregnancy, we have 2 different types. So there's the type without protein and the type with protein. So it becomes important to distinguish which is which, because the type without protein is a serious thing, but with protein it becomes even more severe, because from research and from what we've seen and observations, the hypertension with protein has a more severe or significant effect on the mother, the pregnancy, and the baby. So preeclampsia, which some of you might have heard, means hypertension with protein. Now we ask, who is at risk of developing preeclampsia? Because we all don't want to have preeclampsia or have relatives who have preeclampsia. There's still so much research going on about preeclampsia. So much research is going into it. We are trying to find out if there is a simple blood test which can be done even before someone is pregnant or just as soon as they are pregnant to determine if they will develop preeclampsia, obviously because of the risk it has on the mothers and the babies. So far, there have been, some countries have developed some simple blood tests to determine who will have and who won't have, but it's a very expensive test and it's not available to everyone. So we still go by what we know to find out who is at risk of developing preeclampsia. And like I said, the one with the protein is what we are most worried about. The hypertension in pregnancy with the protein is the one we are most worried about. So anyone who in another pregnancy, so in a previous pregnancy, if you've had preeclampsia or hypertension in pregnancy developing, that alone puts you at risk of developing it again. And also how early it developed in the pregnancy raises your risk even higher. So if you developed it at 20 weeks as compared to somebody who developed it 20 weeks, which is 5 months, or somebody who developed it at 8 months, your risk is more. And also how severe, so how high were the blood pressures in that pregnancy, it also puts you at risk of developing it again, and even much more severe or similar severity as the previous time. So that's the first risk factor. If you've had it before, the chances of having it again are very, very high. So at the time you book your pregnancy, it's very important to let your doctor or your midwife know that you've had it before, so that we can risk stratify you and we know what interventions we'll give to you. So I'll talk about the interventions we have for people who we know are at risk. I'll talk about that later. The second thing is extremes of age. So teenagers or adolescents who get pregnant, and then women over 40 are at increased risk of developing pre-eclampsia. So extremes of age, teenagers or adolescents, and then people over 40. And then also, if there's a family history, so if your mother or your sister has ever had preeclampsia, which is hypertension in pregnancy with protein, you are at increased risk. And then heavier, bigger, or obese women, and we're also at increased risk of developing preeclampsia. So the body mass index is the subjective way, or the standardized way we use to determine whether somebody's weight falls within the appropriate range. So it is your weight divided by your height squared. But now there are so many apps, and you can even put it in the internet to find out whether you can Google it to find out whether you are within the right BMI. So a BMI, which is body mass index, especially between 30 and 35 going. So that means the heavier or more overweight you are, the higher your chances of developing preeclampsia in pregnancy. Then the other risk factor is if it is your first pregnancy. So if it's your first pregnancy, there's also increased risk of developing preeclampsia. And then, if you are carrying multiple pregnancy, like twins, triplets, atamame, fine, it's nice. But it also becomes riskier with the pregnancy, because your chances of developing preeclampsia are higher. Then, if you have a long interval between your births, so if it's more than 10 years, so you had your first child and then 10 years later you're having your second child, it also puts you at increased risk. As I said, still a lot of research is going on. We don't know why it is like that, but that's what has been found. And then anyone with a pre-existing medical condition like hypertension itself before falling pregnant puts you at increased risk of developing hypertension with proteinuria, which is the preeclampsia, the one we are most worried about. And then people with kidney disease, people who are diabetic, and then people with sickle cell. So if you look at this, we've said that people, if you've had it before, if your mother or sister has had it before, if you're an adolescent or teenager or over 40, if you have a body mass index or you are heavier or overweight, if you're carrying multiples, if it's your first pregnancy, if you have diabetes, sickle cell. So basically it's a wide range of people. A lot of people fall within this category. If you take most women who are pregnant, everyone who is pregnant for the first time in itself is at risk. So it means that this preeclampsia is very, very important to suss out or to look for at each antenatal visit. So that shows you just how important it is to have hypertension pregnancy ruled out at each and every visit. So hypertension shouldn't be taken lightly at all in pregnancy. I'll be talking about the symptoms of it soon, and you'll see why. I'll talk about a clinical scenario as well, and we'll see why it's very important to always attend your antenatal visits when the time is due, not to skip appointments. So the symptoms of hypertension in pregnancy, it can range from you having no symptoms at all, nothing, no symptoms, nothing. You feel well, you feel fine. In fact, for some people, the day that they are feeling their best, they get to hospital and then their blood pressure is checked and they are told that they are being admitted because they have hypertension in pregnancy. So for some people, they have no symptoms, and that's the dangerous one, having no symptoms at all. And most women actually feel that way. They don't have any symptoms at all. So here is why I say it's very important to attend your antenatal visits regularly, because if you are not having any symptoms but you present and you have your blood pressure checked or the your urine checked, then it can be picked up that you have hypertension or not. Then there is also the symptom of having a headache. Headache is common in pregnancy, so this is where it also becomes really tricky. Most people have headaches in pregnancy. So how do you know which is which? So typically, the headache with preeclampsia is at the front. So it's called a frontal headache. So it's usually at the front part of the head or just right behind the eye. But when you ask somebody, show me where the headache is, they will just point to the forehead. So it's a frontal headache. Then sometimes there can be visual disturbances like blurred vision. You are somebody who sees well, you don't wear spectacles, or you wear spectacles, you know what your baseline is, you know how well you can see, and then suddenly you are developing blurred vision. Things look a little dark, or some people develop they start to see flashing lights. So it's the second symptom is visual disturbances, either presenting as blurred vision or flashing lights, or some people describe it as seeing spots on the eye. Then rib pain. So around the right rib, that's where part of the liver is, or pain up here in the middle, up here. So the epigastric pain up here or on the right side. Some people present, that's how they present with their hypertension in pregnancy. Nausea and vomiting is also one, but nausea and vomiting is very non-specific. But I don't think any pregnant woman will be having excessive vomiting and nausea or more or less, should I say, vomiting, and won't present to the hospital. So this is where it becomes important. Basically, some of the things I'm saying, like the headache, are normal in pregnancy. It's difficult to know which is preeclampsia and which is not. So I would advise that if you feel anything unusual, you need to go to the hospital. It's better to be told at the hospital that there's nothing wrong with you than to stay at home and not be sure of what's going on with you, and then later on end up having not so good news. So the last symptom, this is not exhaustive. There are other things which people present, which doctors pick up, but the other symptom is rapid swelling of your face. That again too, most pregnant women have the swollen nose and the puffy face. So how do you know which is which? You can only know by going to the hospital. But if you wake up one morning and you realize that you have a sudden puffiness of your face or even the whole body, it could be an indication that you have preeclampsia. Also swelling of the feet. So to recap the symptoms, the most dangerous one to me, and you would agree with me, is the no symptoms. That one is dangerous. It's like you feel good, you are going about your usual activities, but there is something sinister, there's something going on with you and you don't even know. So no symptoms. Luckily, that one can be picked up when you go for your antenatal visit, so it's very important not to skip your visits. Headache, typically at the front side of your head, so frontal or behind the eyes. Visual disturbance, so you have blurred vision, dark vision, or like speckles floating over your eye, or flashing lights. Some people also say that they have sensitivity to light. Then the right rib pain or pain in the middle part of your chest, just right here in the center, on the right upper part of your abdomen or your stomach. Nausea and vomiting, which is non-specific. And then rapid swelling of your face, arms, or even your feet. So in conjunction with the symptoms, there are some things that your midwife or nurse will pick up. So the blood pressure of more than 140/90, the protein in your urine, and then they might notice the edema, or when you stand on the scale and we compare the weight. So that is also another way you see that somebody has been seen over a short period of time, but the weight gain is a lot and it's not fat. It's not like weight gain from fat. It's actually from the fluid due to the hypertension. And then some people also present with confusion. And then we have also noticed not so recent times, but it's one of the things that we pick up. Sometimes the mother has no symptoms. Her blood pressure can be just about normal, but on ultrasound scan, the baby is not growing well. So it means that the blood pressure has bypassed the mother, the effects have bypassed the mother and gone straight to the baby. So that's also another way. So you have a baby who is smaller in size, which we call a growth restricted baby. So growth restriction, which is a baby who is supposed to reach a certain size, doesn't get to that size. So a growth restricted baby. So what are the effects? Facebook is off. It's not off. So what are the effects? What are the effects of hypertension on pregnancy? So the effects can be on the mother and they can also be on the baby. So with the mother, some of the effects which can happen so quickly, somebody gets diagnosed at one time, within a few hours or a few days, the person has got very, very sick and deteriorated quite quickly. So some of the effects we see when we draw bloods from you or take bloods from you and take it to the lab. And there are certain things we look out for, like what is happening to the kidneys, the liver, and the blood. So the effects on the mother include kidney failure. So this shows you just how important it is to detect hypertension in pregnancy. So kidney failure, which is a big thing. Kidney failure, the kidney is a major organ in the body, and it helps with the excretion or passing of urine. So there can be kidney failure to the extent that you are not passing enough urine. The liver can be affected, it can be slightly damaged. Then there can be bleeding or clotting problems. So all this is just the hypertension. There can be bleeding problems, even bleeding into the brain. And then there can be eclampsia, which is the seizures or the fits, which we really, really don't like. So while some people might argue that, no, it's just because I'm stressed, so I'm going home. No, don't monitor me. Oh, it's stress. It's true that stress can contribute to some extent to hypertension in pregnancy. But if it's really stress, when you rest or you sit down and we take two blood pressure readings apart, and you still have the high blood pressure, you can't argue that it's stress, because what is going on in the body has already started to happen. So it's not likely. Most people will be like, oh no, I'm going home, I'm fine, I feel fine. That is the dangerous one, the blood pressure without symptoms. So just listen to your healthcare provider, your doctor or your midwife. You stay in the hospital, even if it's for 24 hours, just for them to monitor you, because they'll be doing the blood pressure readings at certain intervals. If they monitor you or you are monitored and you are fine, you go the next day, but don't rush to go just because you feel fine. That's the dangerous one. That's the dangerous blood pressure and hypertension, the one that you don't have any symptoms, the one that we are really afraid of. And that's what most people have. So those are the effects on the mother: kidney failure, liver failure, bleeding or clotting problems, having seizures, bleeding into the brain. And then on the babies too are also affected. So I talked about the growth restricted baby. So a growth restricted baby is a baby. The growth restricted baby is a baby who is tiny and doesn't reach their maximum potential. This is because of the effects of the blood pressure on the baby. So it's like there's not enough flow, oxygen going to the baby. Then there's something called placenta abruptio, which is separation of the placenta. It presents with bleeding and pain, and sometimes sudden loss of the baby can happen. The babies can pass away. So overall, having hypertension in pregnancy influences the timing of your delivery. So that's why it's important to know which type of hypertension a woman is having. If it is chronic hypertension, and she's on treatment, we know how we'll time the delivery. If it is preeclampsia and it's worsening, we also know how we'll time the delivery. It also affects the type of delivery you have. It doesn't necessarily mean that you have a cesarean section, but if that is what is deemed safer for you, then that's what you end up having. This goes to say that the hypertension in pregnancy also determines whether or not a baby will be born premature. And in fact, it's one of the leading causes of babies being born premature worldwide, mothers having hypertension. And the truth is that hypertension in pregnancy... Oh, sorry, Facebook family. I'm told that the network went out. I'm not too sure what happened. It's the same network we are using for the for Instagram, sorry. So if your blood pressure is worsening, or we do your labs and the things we are looking out for, like your kidney, liver enzymes, and your blood clotting enzymes are getting worse, or if you have a seizure, that is the fit, then it means that it's time to deliver your baby. Unfortunately, it might not be 9 months, but remember that the health of a healthy mother determines a healthy baby. So if the mother is going to be sick and she wants to continue with the pregnancy, at the end you might lose both the mother and the baby. So the timing becomes important. You also don't want to have a preterm baby, but we will weigh the risk and the benefits. If it's going to be beneficial to the mother and the baby for the pregnancy to be carried on, then we carry on. So you might end up having an early delivery by either induction of labor or a cesarean section. Induction of labor is when you are given medication to drink to have the baby. So how do we prevent hypertension in pregnancy? That's the big question. We still don't know enough about it. It's been around for so long, so many years, but still not enough is known about it. But we talked about the risk factors in the beginning. Some of the risk factors are things we can change. Others are things that can't be changed. So the single most effective tool, especially for us in countries where there isn't enough access or enough funds, to be doing the expensive lab work to determine who have preeclampsia, it means that antenatal visits are very important, because that is where you get your blood pressure and your urine check. So it's very important not to miss your antenatal visits. Number one, you get your blood pressure and your urine checked on. So it's a single effective screening tool to determine who has hypertension in pregnancy or not. And that alone, blood pressure and checking the urine, has saved many lives of mothers and babies. So I'll repeat it. Attending your antenatal visits is very important. Not skipping your antenatal visits, or even if you do skip it, just quickly catch up. Prolonged periods where you don't show up, not good at all. So help yourself, help your baby, attend your antenatal visits regularly. So how do we reduce the risk? Because we don't have the research to pinpoint and say that this person, this is what we are going to do. This person won't happen to you. No. Pre-conception care, which is care before you, seeking health care before you actually fall pregnant, becomes very, very important. So pre-conception care is something that's not yet very popular in Ghana, but some people know about it and they go and get checked. So pre-conception care is very important. At the pre-conception visit, if you're already hypertensive, you need to see your doctor, tell your doctor what medications you are on. If you're on medications that are going to be unsafe for falling pregnant, your doctor might switch you before you get pregnant or as soon as you get pregnant. Make sure that if you are hypertensive, your blood pressure is well controlled before you fall pregnant. please make sure that your blood pressures are well controlled if you know you're already hypertensive, even before you fall pregnant. And I'm not talking about a month before you fall pregnant. Well, it's fine if you didn't know about it and it's a month before, but then I mean, well before you fall pregnant, make sure that your blood pressure, if it can even be 3 to 6 months before you plan on falling pregnant, please make sure that your blood pressures are well controlled. I talked about the height to weight ratio. So if you intend falling pregnant, ideally you should fall between the body mass index of 30 to 35. I talked about how you can calculate it, but it's kilograms per meter squared. But if you just key it into Google, it will tell you what the right range is. So falling or maintaining a healthy or normal weight before you fall pregnant, so as part of preconception care, is one of the ways. I also talked about the risk factors of being diabetic, hypertensive, having sickle cell, or having kidney disease. So if you have any of those conditions, please make sure that you have good control over them before you actually fall pregnant. And then talk to your doctors about the medications you are on so that they can switch you as soon as you fall pregnant. And once you fall pregnant, it's important to book early. Booking means the first visit. So you book early. At the first visit, your risk can be stratified, and we can find out who is most likely to develop preeclampsia and who isn't. And there are certain things which we do for people who we think will be at very high risk. Like I said, when you fall pregnant, don't skip your checkups. Keep to schedule, attend all your checkups. Then so what happens now is that for people who already have hypertension or have had severe preeclampsia or hypertension pregnancy before, the new thing that we do is that if you don't have any contraindications, that is, you don't have any allergies or it don't affect you because you have an ulcer, we put you on low-dose aspirin. So low-dose aspirin from research has been shown to improve the outcomes of people who are likely to develop preeclampsia. So while for some people it hasn't been able to completely eliminate their chances of developing preeclampsia, what the low-dose aspirin has been found is that, if you find out that somebody has had preeclampsia before at 5 months, that's hypertension, pregnancy, proteinuria. In her other pregnancy, it was about 5 months. When you start them on low-dose aspirin very early in the pregnancy, so by about 12 weeks, we start you on low-dose aspirin. It's been found that it delays how soon if you develop preeclampsia. So it might happen later, maybe in the 30, 35, so you won't have a chance of having a preterm baby. And for some people, it even prevents it altogether. So low effective intervention for people with the chance of developing preeclampsia. And I've talked about the symptoms already. If you do develop any of the symptoms we've talked about, or you are not sure, you need to report to hospitals very, very early. So that's it for preeclampsia. I've talked for quite a while. I know there might be questions. Let's see. Somebody asked a question, but I lost it. So you can send in your questions or suggestions, or if you want to join and contribute, you can. I think it was on Instagram. Yes, I talked about this. I think there was a break in the line. Somebody is asking, can hypertension in pregnancy affect the baby? Yes, hypertension in pregnancy can affect the baby. It affects both the mother and the baby. So with the babies, there's growth restriction, which means that a baby who is supposed to attain a certain weight while inside the mother doesn't attain that weight. So it's a small baby for the number of weeks the baby is supposed to be. Also, there can be placenta abruption, which is the sudden separation of the placenta, which is the afterbirth, and it results in bleeding, and there can be loss of the baby. Also, some people develop fetal distress, so the babies are not getting enough oxygen and blood flow to them, and they develop fetal distress, which is dangerous for the babies, and the babies can pass away. So yes, preeclampsia and hypertension in pregnancy can cause growth restriction to babies. So that is small babies. It can cause abruption, which is separation of the placenta before it's supposed to separate. So while the baby is still inside, which will manifest as bleeding and severe pain, leading to sometimes sudden loss of the baby, the passing away of the baby. No questions. Okay. Are there any more questions? No question. What's the other question? Okay, the other question was, Doc, how soon should one be attended to when one has preeclampsia? Because assuming you have no symptoms and your next antenatal is weeks away. So how soon should you be attended to when one has preeclampsia? If you are at the hospital and you present with preeclampsia, you usually get admitted. So you usually get admitted and attended to. But for those who don't have symptoms, so that is why antenatal visits are scheduled at certain times, depending on what your risk factors are. So if you are more at risk, you come to the hospital more frequently. Unfortunately, we don't keep you in hospital throughout the pregnancy and check your blood pressure every day. So what I would recommend is that you can have a blood pressure monitor, like a BP machine or a SFIG with you at home, but it should be one that is calibrated or good for pregnant women, because you can't just use any blood pressure monitor and think that is going to give you adequate reading. So regular antenatal visits, you can have your own BP monitoring machine and be monitoring at home throughout the pregnancy. So yeah, that's it. Someone says, please, how about after birth your BP goes up? What could be some of the reason? Can the eagerness to leave the hospital be a reason? If yes, how can you handle it? So when we started the live, I talked about hypertension manifesting for some people, not even during the pregnancy, but after delivery, especially 3 to 4 days after delivery, and even up to 6 weeks. So the physiological changes of the body in pregnancy, that is the hormonal changes, still go on up to 6 weeks. So you can have some people also developing high blood pressure or their blood pressure going up only after delivery. It's still within that hypertension pregnancy spectrum. How is it handled? It's not necessarily because of somebody's eagerness to go out of hospital, because like I said, some people will tell you that, oh, it's because I'm stressed, that's why I have high blood pressure. The person will sleep, wake up, and the blood pressure is still high. So usually, depending on how high the blood pressure is, you might be put on medication, or you'll be asked to come back after a few days to recheck the blood pressure. So that's how we can handle it. And the symptoms I described earlier on, with the headache, the blurred vision, the right rib pain, it can all also come happen after you deliver. So you are still, once you deliver, it doesn't mean that you are out of the zone where things that happen to pregnant women won't happen. Up to 6 weeks, all these things can still happen to you. All these things can still happen to you. So yeah. How these are after bed. How common is hypertension in pregnancy? So I said it's very, very common, because when we started and we looked at the risk factors, we said who is at risk. And looking at it, it looks like it's almost everybody who is pregnant who is at risk. So if you've had previous hypertension in another pregnancy, you are at risk. If you're at extremes of age, so if you're a teenager or you're over 40, you are at risk. If you have a family history where your mother or your sister has had it before, you are at risk. If it is your first pregnancy, you are at risk. If you have a body mass index of between 30 and 35 or more, you're overweight, you are at risk. If it's been more than 10 years between your children, you're also at risk. If you have a pre-existing medical condition like hypertension, diabetes, sickle cell. So basically, anyone who is pregnant is at risk. How common is hypertension in pregnancy? Very, very common, much more common than we want to admit. It's very, very, very common. Okay. On Instagram, does prescribed medication which is deemed suitable for pregnancy, like labetalol, affect the health of the baby? So labetalol is one of the medications that can be used in pregnancy, but it's not the first line of treatments usually according to the recommendation, but also depends on what is available. So labetalol is safe in pregnancy. The only thing is that it can cause, we have different types of routes of giving labetalol. It can be given orally and through the drip. Giving it through the vein can cause a sudden drop in blood pressure. So yeah, labetalol is not unsafe for babies. And then the other question is, some patients have higher readings in the hospital compared with when taken at the hospital because of anxiety. So what you're describing is white coat hypertension. Yes, white coat hypertension is real. It is real. So if someone is pregnant and has hypertension because of the risk and tells you that it's because she's in hospital, for me, because of the risk associated with having hypertension in pregnancy, the best thing to do would be to keep the patient in hospital for some hours or overnight, because definitely there will be some point in time where the blood pressure should not be so high because of this anxiety. It won't be persistently high. But remember that it's not just the blood pressure we are looking at. It's in conjunction with the symptoms, how it's affecting the baby, how the baby is growing, and whether there is protein in the urine. So my recommendation for especially a pregnant woman who insists that the blood pressure is high because of anxiety is to possibly stay in hospital for observation over a period of time, probably 24 hours, 12 hours, or overnight. Because you wouldn't want to dismiss the hypertension as being due to anxiety of being in hospital, and then later on you find out that it's something more serious or sinister. Does previous preeclampsia increase your risk for later pregnancies? Yes, it does. I mentioned that one of the risk factors is having previous hypertension in a pregnancy. What is the suitable mode of delivery for a hypertensive mother? This is a very good question. So I mentioned it earlier. I'll probably have to recap because the line was breaking. People didn't hear or people joined late. So the mode of delivery depends on a number of factors. First of all, before we talk about the mode of delivery, the timing of delivery. I mentioned that one of the most common causes of babies being born prematurely worldwide is preeclampsia or hypertension in pregnancy. So hypertension in pregnancy is now affecting the timing of delivery, depending on how severe the person is getting. So there are things we are looking out for, like whether her kidney test is worsening, whether her liver test is worsening, whether the blood clotting abnormalities are getting worse. Now, if they are getting worse, mother comes before baby at this time. That's the reality, because a healthy mother determines a healthy baby. If the pregnancy is making her deteriorate, then she needs to be delivered. Most of the time, the blood pressures are so high that the process of putting the mother through labor or inducing her can make the preeclampsia worse. So that is how come most people end up having cesarean sections because of the raised blood pressure. So that is the reality, because the mode of delivery, you don't want to be giving somebody medication to get her into labor, and then all of a sudden she has a sudden seizure or fit, which I mentioned is one of the things that happen. So most of the time you notice that the mode of delivery is cesarean section. However, I'm not saying that is the best mode of delivery. It depends on the timing, whether or not, it depends on whether how severe the blood pressure is. I mean, if it's a blood pressure that is not so severe but still deems her to be delivered, she can be given induction of labor, so she delivers by vaginal delivery. But most of the time we realize that the severity of the condition and putting everything together, the patients end up having cesarean section. Sometimes even the babies already are small, so they end up going into fetal distress, and then the mother needs a cesarean section. So the mode of delivery or depends on the timing of delivery, the severity of the hypertension, and other factors which your doctor or your healthcare provider will determine. I remember being prescribed aspirin throughout my pregnancy, preeclampsia at B. I had suffered from it in my second pregnancy. Also, should one attempt a third pregnancy after a history of preeclampsia? So I mentioned that aspirin is one of the things that we have found to help with preeclampsia, but it doesn't completely eliminate the preeclampsia for some. It just delays how soon it will happen. So if you had preeclampsia at 20 weeks and you are put on the low dose aspirin early, so let's say by 12 weeks, research has found that for most people, even if it doesn't prevent you from getting the preeclampsia, it delays how soon you end up getting the preeclampsia. So yes, and then the second part of the question is, should one attempt a third pregnancy after a history of preeclampsia? Okay, your body, your choice. If you weigh the risk and the benefits and you feel like you can handle another pregnancy after having preeclampsia, you can. If it is mild preeclampsia, you can consider it. But if you've had severe preeclampsia, or you had eclampsia, which is having fits or seizures in pregnancy, the recommendation is that you don't. Well, that's a tricky one. The risk of having it again and having the seizures are high. So it's your choice. You decide. But if you do fall pregnant, we'll put you on the low dose aspirin, which is the recommendation. We will hope that it doesn't happen again. You'll be monitored closely in the pregnancy. So the choice is entirely up to you. Attempting a third pregnancy after a history of severe preeclampsia or a fit. Mild preeclampsia, yes, you can, but still every pregnancy is risky, so choice is entirely up to the person who wants to fall pregnant. So in conclusion, we talked about the definition of preeclampsia, which is blood pressure or hypertension in pregnancy, which can be chronic, which means you had a pre-existing blood pressure before you fell pregnant, or hypertension, which was detected before 20 weeks, which is 5 months. And then we have the gestational, which is hypertension in pregnancy, which is after 20 weeks. There can be hypertension in pregnancy with protein and hypertension without protein. The one with protein is what we are most worried about. The symptoms can range from having no symptoms at all, which is the dangerous one. No symptoms. The day that you feel good and you go to hospital, you're feeling good. Then they check and they tell you that you have hypertension in pregnancy. So that's the dangerous, the symptom that I don't like is no symptom. You can have a frontal headache, blurred vision, flashing. You can have flashing lights, pain under the right rib or the center of the stomach, nausea, vomiting, swelling of your legs, puffy face. At each visit, we check the blood pressure and your urine for all pregnant women just to see who is developing preeclampsia or hypertension in pregnancy. Hypertension affects the mother and the baby. Hypertension affecting the mother can cause kidney failure, liver failure, clotting problems, bleeding into the brain, seizures or fits, which we call eclampsia. And some people even end up going on to develop hypertension permanently. Hypertension can also affect the babies. I said we still don't know so much about hypertension, but research has shown that people who are at risk, giving them low dose aspirin prevents early development of preeclampsia. For a few people, they might not develop it at all. Preconception, seek help if you know you're hypertensive already. Try to get good control of your blood pressure. If you're diabetic, you have sickle cell, try to get good control of your disease. When you fall pregnant, book early. Don't skip antenatal visits. Attend regularly. If you have any symptoms or signs, please report to your doctor. It's rather better to go and be checked and then you're told that there is nothing wrong with you than to sit at home and then develop serious complications. So, thank you to everyone who has listened or watched. It's been interesting, and I don't think there are any more questions. I'm going to put my handles of where to find me in the comment section. You can follow me, you can DM me to ask more questions. For Instagram, it's Dr. Karen.Aminiampo. I'm going to put it in the comments now. Yay. For Instagram. Are you able to tell people frankly that they should be pregnant? I'm sorry, please, can you repeat the question? Are you able to tell people frankly that they should be pregnant again? I don't get the question. Tell people frankly that they should be pregnant again. Okay. Thank you to everybody who has joined. Thanks for watching. Okay. And if you have that they shouldn't be pregnant, am I able to tell people frankly that they shouldn't be pregnant again? So there is patient autonomy. So you can only advise, but the choice depends on what the person wants. So you decide. You can only be advised. If you have a life-threatening condition or something that will adversely affect you, we'll put before you the risk and the benefits, and you have the rights over your body. So you are the only one who can decide. Thank you, everybody, for watching. And please, if you have questions, you can DM me or send me a message and I'll answer. And hope to meet you or see you again next time. Bye, everybody.